Good to see you all here today. Thank you for your patience. We had a few technical difficulties, but today we are going to be talking about professional and ethical responsibilities presented by Avis Garcia. This webinar is provided by the National American Indian and Alaska Native ATTC, a program funded by the Substance Abuse and Mental Health Services Administration, and we are actually located outside of Iowa City, Iowa. CEUs are available upon request. We are currently waiving any fees for CEU during quarantine. We will go ahead and send a webinar follow-up after this event, and it will contain CEU instructions for ordering those. And you will also receive a recording and the handouts that we are going over today. After the webinar is completed, we are going to go ahead and forward you to the webinar follow-up. It's a GIPRA survey. It takes just a few minutes of your time, and we really appreciate any feedback you have to give to us so that in our future events we can continue to improve and bring you relevant material. Today's speaker is Avis Garcia. She's an enrolled member of the Northern Arapaho Nation and affiliated with the Eastern Shoshone Tribe of Wyoming. She earned a doctorate in counselor education and supervision at the University of Wyoming and is also a licensed professional counselor and licensed addictions therapist. For 19 years, she has been a mental health provider in the treatment of Native American youth and families. She is also an advocate of education in Indian country, a resource provider for promoting cultural enhancement of evidence-based practices and practice-based evidence of treatment approaches for Native American children and their families exposed to trauma. Avis Garcia has more than 19 years of experience and is knowledgeable about the concerns of implementation and adaptation of evidence-based practices being introduced into Indian country. Avis is currently employed as an executive director of a nonprofit substance abuse treatment center in Cheyenne, Wyoming. We're so glad to have you here today. I'm going to go ahead and give you the reins back.
Okay. Thank you.
And everyone, we are going to go ahead and save questions for the end. But if you have any questions throughout the presentation, please feel free to post them in the chat. In the chat, you can also share where you're from and any comments you have about the presentation. So good to have you all here today.
Is this working okay? Are you seeing my whole screen?
Yeah, we can see all of your notes and everything, but that's okay.
Okay.
But if you want to do the opposite way, that's fine too. Whatever you're most comfortable with.
Okay. I wanted to do the slides myself, and if this would move, I can get underneath there. Okay. Play from current slide.
Perfect. Yeah, that's a great view.
I'm trying to get on the same page you are so I can read my notes. Sorry, guys. Okay. And then I can just change these now. Cool. All right.
Yeah.
Yay. Sorry, guys. I had a last minute technical connection problems. My computer wanted updates in the middle of trying to practice this before we started. But today's webinar, we are going to go over the ethical principles for counseling and the 13 principles of effective treatment and the professional code of conduct and ethical responsibilities that we have as counselors, looking at the code of ethics, patient rights. Okay, boundary issues and supervision. And the goal of this presentation is to prevent your client's problems from becoming your legal or ethical concerns. Okay, vocabulary for this module is morals, principles, and ethical values, and the scope of practice. Okay. Sorry. Okay. Okay, principles of effective treatment are substance use disorders are a complex but treatable disease that affects brain function and behavior. No single treatment is appropriate for everyone. Various types of treatment need to be readily available. Effective treatment attends to multiple needs of the individual, not just his or her drug use, and remaining in treatment for an adequate length of stay. People can and do recover from substance use disorders. The notion of one pathway or approach to treating substance use disorders is no longer sustainable. There may be common themes or particular approaches and programs that work better for some. Treatment does not need to be voluntary to be effective. And drug use during treatment must be monitored continuously as lapses may occur. So the place where I work, we do random UAs at our job, and we have a breathalyzer for when they check in. And patients should also be tested for HIV and AIDS, hepatitis B and C, and TB and other infectious disease, as well as targeting risk reduction, counseling, linking patients to treatment if necessary. Okay, there is mandated treatment versus voluntary treatment, and research has shown that either or is just as effective. So one is not better than the other. And to be honest, in my work experience, I was talking to an intern last night, and I told her, I honestly can't think of one person in this program right now that is here voluntarily. You know, they didn't just knock on the door and say, hey, I need treatment, or I think I have a problem. I would say 99% of them are referred by court systems. Okay. Foundations for understanding, vocabulary, professional and ethical responsibilities. So that applies to how we do our work, our values, morals, and perspectives, the distinction between legal and ethical. Ethical guidelines that counselors need. Ethical guidelines for professional behavior are needed before, during, and after the treatment of a client. So that's ongoing. Ethical guidelines for avoiding discrimination and stereotyping, guidelines for confidentiality and the circumstances for which they may be breached. I'll cover that soon. Standards for developing and maintaining healthy relationships with clients and colleagues. Understanding of the moral and ethical responsibility to protect clients from harm is number one. And I found a couple of cartoon slides that I thought were real appropriate to this presentation. And this cartoon says, yeah, that does sound like an ethical dilemma, Phil, but relax, it's only a problem if you have a conscience. And then he says, that's just it, I think I do. He says, don't worry, I won't tell a soul. Ethics can also be very challenging. Here's another cartoon that says, when you say ethical, do you mean marginally ethical, semi-ethical, or appearing to be ethical? Some common misperceptions are ethics apply to individuals and not agencies. They affect other people, not us. Recovering persons hold high standards and not violate the code of ethics. And law is more important and holds people to a higher standard than a code of ethics does. So some agencies have their own ethics, and my company uses our professional statement. And then recovering people, it says that recovering people hold high standards and do not violate the code of ethics. That, you know, again, this is a misperception, and we have to be mindful of that. And the law is more important and holds people to a higher standard that a code of ethics does. Source of ethical standards. This is a quote that I found, and it says, someone got into trouble, so a rule was made to keep the next person from making the same mistake. And that's from Dan Laubnitz, who is an attorney. And the scope of practice for substance abuse counselors is general counseling theories and treatment methods, screening, assessment, and diagnosis, treatment planning and case management, individual, group, and family counseling, patient, family, and community education. The first one here is we have a duty to warn. The Tarasoff versus Regents, the University of California in 1976, which demonstrated and established the duty to warn. The Tarasoff decision, she was, this is Tatiana Tarasoff, and she was a student in 1968 at the University of California in Berkeley. Some of you might remember this from maybe your basic psychology class. And she was dating a gentleman by the name of Pransajit Podar, who was obsessed with her. And when she broke off the relationship, Podar bought a gun to orchestrate a life-threatening situation to prove his love. His psychiatrist, Dr. Lawrence Moore, believes he had a psychotic disorder. Okay. And he did inform the campus police, but they determined he was stable and they released him. He then broke into Tarasoff's house, armed with a knife and a pellet gun, and he proceeded to shoot her with the pellet gun, and then he stabbed her 14 times, resulting in her death. No one had informed her of Podar's intentions. The duty to warn with anything requires that you go to the person being threatened and the authorities. Sadly, she lost her life, and the Tarasoff family sued the University of California. In 1976, the court rewrote their opinion. It says, when a therapist determines or pursuant to the standards of his profession should determine the patient presents a serious danger of violence to another, he incurs the obligation to use reasonable care to protect the intended victim or others and likely to apprise the victim of danger. How is duty established? Our duty to clients is often spelled out, are established in a variety of ways, such as what we advertise, what we verbally explain in our first contacts, informed consent paperwork, and billing codes submitted to insurance companies. So when we start our counseling sessions with clients, we like to review our professional disclosure statement. That's what we call it. And here in Wyoming, everybody that is licensed or provisionally licensed is required to have a professional disclosure statement. That disclosure statement tells about what your level of education is, what your certifications are, what your specialties are, and then it goes on to address the ethics. And to summarize it in short, I always let the client know that, I'm a mandated reporter by the state. And if I suspect they're in danger or someone else's life is in danger, that I have to report that. Okay, our expected response to the risk of a client harming another has evolved over the last several decades, and you will want to make sure that you are up to date on your state regulations. Ethical values, be good, do good, and above all, do no harm. My next slide, this is the Tinkerbell effect. And this is an example of what that Tinkerbell effect entails. It's the rule of law exists as long as enough people believe in it and insist that everyone believed and act as if it exists. So this is referring to Peter Pan when he is believing in Tinkerbell. And then it also offers support for law. When its support for law ceases, its protection stops. Law is wonderfully strong and terribly fragile. In a time of crisis, there is a temptation to stop believing in it. And the rule of the law in this, I believe. Privileged communication, legal issues affecting human service professionals, professional communication, confidentiality. We do not release anything without the patient's informed consent. We have a duty to serve, to help the people that seek our services. We have a duty to warn, to protect the safety of others. And documentation is very important. This always has to be done for just about everything that you do, especially when it comes to ethical situations. Professional and ethical responsibilities. The first one is to adhere to the professional code of conduct of ethics, adhere to federal and state laws and agency regulations, interpret and apply the information. And these guidelines are for you to follow. Okay. Recognizing the importance of individual differences, there's no cookie cutter treatment. You have to do the best you can to tailor your treatment to that client's needs. Utilizing a range of supervisory options. Your supervisor is a resource for you to use when faced with ethical decision making, and it is a routine significant event. Your supervisor or manager will likely have some experience to assist you in making the right call. And always conduct self-evaluations. So every now and then it's good to go through your work and read your code of ethics and remember that that's what you have to follow in all the work that you do. Some professional and ethical responsibilities continued. We all need to continue professional education. That's why you guys are here today. Participate in ongoing supervision. Maintain one's own physical and mental health. So a good ethics training can provide foundational components for a new clinician entering the field, our vital review for the experienced clinician, especially in a matter surrounding mandatory or reporting to the child welfare. Again, weekly supervision is very important in a clinical setting. Private practice can be challenging, so you will need to find a colleague or a mentor. And self-care is absolutely essential. It's important to know the code of ethics for alcohol and drug counselors. So for us, it would be NAADAC, the Association for Addiction Professionals. And if I have a link here that will give you some more, that link right there will give you the whole several pages of the ethical codes. And the member expectations are to put us in a position of trust and responsibility with a high quality of care in the client's best interest, assist clients to help themselves, and adhere to the code of ethics with a high level of conduct, perform competently and consistently, read and promise to adhere, to the Code of Ethics. Failure to meet ethical standards risks disciplinary action or revocation. The Code of Ethics examples for alcohol and drug counselors, and this is the most up-to-date list, that number 1 covers the counseling relationship. 2, confidentiality and privileged communication. 3, professional responsibilities and workplace standards. And working in a culturally diverse world. This is a more recent addition to the Code of Ethics in looking at, when you're providing services, ensuring that they're more culturally relevant to the individuals that are being served. Assessment, evaluation, and interpretation. E-therapy, e-supervision, and social media. This is also a new addition. Now with the COVID, we're doing webinars, we're doing therapy online, we're doing supervision online, and we also need to be mindful of social media if you have one. We don't want to be friending our clients and being careful of what you put on your page. Supervision and consultation, resolving ethical concerns, and research and publication. Agency ethics. Some agencies do establish their own ethics. Ours generally follows the NAADAC Code of Ethics, and we have everyone sign off on it every year that says that they read it, they understand it. So we make sure that we review that every year. So this is also in regards to the disclosure of personal recovery. Some agencies, even though the therapist might be in recovery themselves, some agencies may ban that disclosure and others may encourage it. And I kind of just leave that up to the therapist of how they want to handle that, because I feel that a lot of clients can relate to someone who's been through the same situation that they've been through. Okay. This can be a slippery slope for a lot of clinicians. In the past, many counselors were by default in recovery themselves. As the field has evolved over the last 30 years, this has changed. However, disclosure of one's recovery can be beneficial if done appropriately. Yet this must be given careful consideration and done with the patient's best interest in mind. The clinic that I worked for over 20 years had a standing policy that prohibited staff from disclosing that type of information. Ethical complaints. Know your state-specific procedures in filing and processing an ethical complaint. Sorry. Okay. Comprehensive decision-making process. This is when you're looking at an ethical issue and you want to decide if you need to take action or get some advice from someone who may have been there or be able to guide you in the right direction. The first would be to identify the problem and define it. Review the NAADAC Code of Ethics to determine which principles are applicable. Consult with a supervisor or an experienced colleague. Determine if there are any potential legal concerns and if consultation with an attorney will be needed. Number 5, identify all potential courses of action and their potential consequences. Decide on a specific course of action. Implement the course of action and document the entire situation appropriately, and reflect on the outcome of the course of action. Make adjustments if needed. Three key attributes are commitment, competency, and consciousness. So we should have the desire to do the right thing regardless of the cost, the ability to collect and evaluate the information, find alternatives, see if there will be any potential consequences and risk, and have the awareness to act mindfully and consistently when applying moral convictions to behavior. Some important elements: the best decisions are ethical and effective, accomplish desired outcomes, promote professionalism, meet short-term and long-term goals, and remembers the client is always the main concern. Patient rights. Again, we need to not discriminate. And we have to keep confidentiality of our clients. Again, we only release information with their release of information that where they specify exactly what they would like to be disclosed. Some information they would like to keep confidential, and we have to respect that. But like I said, a lot of my clients that are in treatment are referred to us by corrections agencies. So we always have them sign a release of information so that we can communicate with their probation officer or their parole officer. So they have to release some information. Non-discrimination, we can't discriminate by age, race, gender. Avoid personal issues and be knowledgeable about special accommodations. Does someone need an interpreter? Does someone have difficulty with reading? Anything that they might need help with, it's good to be aware of that. Maybe somebody doesn't hear very well and we need to move them close. And I've also had some who really can't do Zoom at all, so we bring those ones in because they're not able to do it on their own. Confidentiality. These slides keep switching on me. Sorry, it's not me, it's the timing on the program here. So it's important to adhere to the federal and state confidentiality laws, know the exceptions to federal law, know how to respond to law enforcement requests for information, and present only necessary data. Some examples of exceptions would be a medical emergency, a records audit, crime or assault to person or property, and we cannot confirm or deny whether someone is in group. A subpoena does not necessarily compel you to breach a patient's confidentiality or to provide records. The general rule, the assurance that information will be kept secret with access limited to only appropriate persons, exception under certain conditions. Both HIPAA and 42 CFR laws prohibit the use and disclosure of records or other patient-related information. And that is from the Legal Action Center. Okay, here's a confidentiality quiz. A treatment counselor is contacted by a patient's medical doctor who is interested in obtaining information about the patient's progress. The patient has given permission to release information. The counselor should give the doctor a copy of the patient's file, give the doctor only the information that is requested, refuse to release the information due to confidentiality requirements, set up a meeting with the patient and the doctor, ask the patient to give the information directly to the doctor. And on the next page, the answer was to give the doctor only the information that is requested. And a lot of release of information forms now list several things that might be requested, such as the assessment, progress notes, their treatment plan, what issues they're working on. So they have to be real specific. UA results, some people don't want that disclosed, but again, they're all required to give us UAs at our agency. Responsibility is to our policies and management, assisting others with knowledge acquisition, and reporting unethical behavior to the proper authorities. And I've had some situations throughout my years of experience, and I think my very first one was at my very first, I want to say, real job providing therapy, where I had a situation that I knew I had to report, but I was like, oh my gosh, I don't know how to do this. And again, going to my supervisor immediately, they were able to give me the proper steps to handle a situation that involved some suspected child abuse. And so we have to report those things. Competence. What areas do you need to work on toward competence? Ongoing education, setting boundaries and limitations, and your professional competence and integrity. So if you're not able to handle children, for example, you don't work with them. If you don't work with trauma, you may know somebody else in your agency that does, that you can refer them to, or you may know your community well enough to know where there are places that they can go get the services that they need that you might not offer. So a lot of times I have people that need psychiatric evaluations, so I have to refer them to those agencies that do offer that. Sorry, it's this computer that's moving these slides ahead of me. Okay. So let's quit switching on me, sorry. Okay, ethical principles in counseling are autonomy, giving the individual the freedom of choice. Autonomy is a principle that addresses the concept of independence. The essence of this principle is allowing an individual the freedom of choice and action. It addresses the responsibility of the counselor to encourage patients, when appropriate, to make their own decision and act on their own values. There are two important considerations in encouraging patients and to be autonomous. So this centers around the person-centered theory, so letting them take charge of their treatment and letting them have input into what takes place in their treatment programming. Non-maleficence, not causing harm to others, above all, not doing harm. This principle is considered to be one of the most critical of all principles. Beneficence is the counselor's responsibility to contribute to the welfare of the patient and to do good. Justice, treating equals equally, unequals equally, but in proportion to their relevant differences. And fidelity, loyalty, faithfulness, and honoring commitments. Patients must be able to trust the counselor. So when you say you're going to do something, they are going to hold you to that. So it's very important to make sure you follow through. Another big one is boundary setting. Again, sorry, these slides just switch on their own and I have to keep moving them back. Boundary issues, again, is not doing any harm to the patient. Transference is when the patient transfers whatever their issues onto the counselor. Maybe you remind them of someone, and then countertransference is just the other way around. It is transference to counselor to the patient. So again, you need to be aware of when something might be happening. Maybe it triggers something with you. We all have our life experiences and we may need supervision for that. More on boundary issues is the dual relationships. Sexual and affectionate feelings versus behaviors, and remuneration, also known as bartering for services. So we can often end up in a dual relationship situation, And you could be their counselor, but maybe they're friends with someone that you see quite frequently, or maybe you're their instructor and then they come to you for counseling. So sometimes when you do have that situation, it can still be done, but proper documentation and agreement between the parties needs to be documented as well. Sexual relationships and intimacy are a big problem. It happens in the field, and I've encountered a couple of these actually, and one I did have to report. And there are different rules and regulations for each agency, and most follow state laws and their ethical codes. Mandatory reporting, again, we just discussed the Tarasoff case. When warning a specific threat to self or others, if there's any child abuse. One of my counselors called me in a couple weeks ago and shared that a client had shown him pictures of some abuse of a kid that she had witnessed, and he didn't know how to handle it. And do I have to report it? And I asked him, did you tell her you would have to report it? And he said he was going to check with me and get back to her. So it's real important to follow up on these issues. And so our proper procedure is notifying the Department of Family Services, and then also sexual misconduct of a therapist. Again, that's a huge boundary. Never having relationships with your clients. Using supervision. Some key points to remember, are to be good, do good, and above all, do no harm. Distinguishing among ethics, morals, and legalities. Patient rights are always important. Your ethics can greatly impact the quality of patient care and the image of the profession. And boundary issues start with the small, innocent transgressions. So oftentimes I have clients that want to request special things, and I have to remind them, if I do something for you, then I'm going to have to start doing the same thing for everyone else, that we try to stick with the program rule. Again, I ask my clients, when I see them in public, how would they like me to respond? If you would like me not to acknowledge you, that's good to let me know. Some people, it's real important to their keeping their counseling private. Okay. These are the references for NAADAC, the Principles of Drug Addiction Treatment, and for the Tarasoff versus Regents, and the NAADAC Code of Ethics. And these are for Iowa, because these slides were created by Steve Stein, and I've just modified them and made some minor additions. So it's important to know your state. I'm here in Wyoming. So we do have a board that licenses our mental health professionals. Some more references here. And that is it. We are already at the end of this. I know I kind of went a little fast. If anyone has any questions that they would like me to answer.
Hi, everyone. That was so great, Avis. Thank you so much. If you would like to speak your questions instead of typing it in the chat box, you can actually just raise your hand and I'll give you permission to speak. Otherwise, please feel free to ask or comment from the presentation in the chat. We have a comment. Thank you for bringing that up. It surprises me that there's little information or guidance from the APA Code of Ethics on social media. That's pretty interesting. All right. Hi, Michelle. Do you have a question?
Yeah. I printed out the NAADAC Code of Ethics, and it's 21 pages. So if you want to get into the nitty-gritty details, the one on e-therapy was the most important one that I had to look at myself, because people were telling me there was certain things I couldn't do. One situation was one of my counselors is licensed here in Wyoming, but she was going on a vacation and she still wanted to run her groups. And some of us said, no, you can't do that. You can't, you know, you're in another state. And I was able to find out that because she was licensed in the state where the clients were going to be, she was able to go on her vacation and still run her groups by Zoom. So yeah, I've had to refer to that more than once. And the social media thing, I never really gave much thought to until I don't know, I get on Facebook maybe on the weekends just to see what's going on back home. and I've see some people on there that might make recommendations, and then I'll see the people pop up that are my clients, and I'm like, why would these people be popping up? And I found out that that's because they're looking you up. So they may actually pull up your Facebook profile. And so I have friends that don't even put their picture on their Facebook profile. They'll put a picture of a cartoon or an animal or something. And then we don't friend our clients. It's just like having an intimate relationship with them. I just say never do it. I've had some say, well, when they're done being my client, you know, then I allow it. And I'm like, well, even at that, we're not even supposed to friend them according to ethical standards for at least 2 years after our counseling relationship has ended.
Yeah, definitely. What was the name of the document that you held up?
This is the NAADAC Code of Ethics, and you can look this up just typing in the NAADAC Code of Ethics and it'll pop up, but I can also attach it in the handouts. This is the best one, and it's the one that I go by. The state, states often have their own, but then they may refer to the NAADAC depending on the specific profession that you're belonging to.
Yeah, we had a question. What about contact with former clients after leaving an agency? Would you still use the 2-year rule?
I would still use the 2-year rule. It's kind of difficult, and there's a fine line. And then when we go back to the Tinkerbell thing, there were times when I'm on the reservation working and I'm thinking, well, do these ethical codes apply to, I'm on the reservation, you know? And
yeah,
we had that discussion at a staff meeting one time, and we all decided, you know, we need to follow these ethical codes, even though we are on the reservation and we think nothing can happen to us, because we never know, somebody else might report something that is probably not a good thing.
Yeah. Due to COVID and all the telehealth changes, how do you see this causing issues with ethical concerns?
The whole telehealth thing, and I just got thrown into the telehealth thing because of, thanks to COVID, you know, we had no other way to reach our clients except through their phones and the computers and the internet. And some examples I might have is I've actually had to come up with a checklist before we start our working with someone who's new, because I had a girl who told me, I'm at my brother's house and she didn't tell me her niece and nephew were there. So every now and then they would pop up, and again, confidentiality for the other people that are on the other end of the line. And I have to stop that session and tell them, you know, you guys need to be just like you're coming to group. You don't bring your family, you don't bring your dog, and you need to be there so that we can actually see you and have you participate. And they have to give us an emergency contact person for just in case something happens, that we have somebody to reach out to. And one of the trainings that I've had recently said that not only do we have contact to that person, but we need to know that that person is available. So there has to be some way that they know, we know that they're going to be available when we're working with that person as their emergency person. So a lot of clients just don't realize that there's confidentiality. I had one guy who was at work, and he was operating heavy equipment, and he's trying to be at work, and I had to catch him after and tell him, you can't do that. you know, the next time you do this, it's going to be a big problem. So don't do that anymore. So that has been something that's created some issues. Some people want to connect while they're in the grocery store. I even had a supervisee put me on Zoom in her car while she was driving. I told her, no, 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 no. I said, you let me know when you get home and we will resume our supervision session. I don't want to do this while you're driving in the car.
Yeah, definitely.
Mm-hmm.
How would you handle being selected for jury duty in tribal court and discover that the defendant is being seen at the tribal behavioral health agency?
Now, is that to defending a client, or can you repeat that one more time?
Yeah, they said, how would you handle being selected for jury duty in tribal court and discover that the defendant is being seen at the tribal behavioral health agency?
Okay, so if I'm right, that means I'm the therapist and I'm
Yeah,
on
I
the
assume
jury,
so.
but then the defendant is actually a client. Okay, a client that I would be seeing also?
Yeah, maybe you were seeing, or maybe even like a close colleague or something like that. They didn't really specify, so I'm sure you could take it a couple different ways.
Yeah, it's really complicated because I'm thinking about our tribal court on the reservation where I'm from, and we don't have jury duty. If cases go federally, then they go through the federal government, and they might have jury duty, but for the most part, we don't have that. So I can't imagine being in that situation. That would also create a dual relationship, especially if you are that person's therapist. And I was told, I don't know how true this is, that if you majored in psychology, that you have a really good chance of not being selected. But when you live in a small community, it can be really challenging because you live in that community. And I worked with a lot of adolescents who were on juvenile probation, and their parents sometimes drop them off, or maybe there might be events going on in the community. I think one example, I went to a powwow and one of my clients was there, one of the kids, and she's like, oh, you got to come meet my mom. And she really wanted me to meet her family. So I was like, okay, I'll go meet your family. And then her brother and sister are like, how do you know my sister? You know? So
Yeah.
some things are difficult because when you live there and you know everybody and vice versa, it is hard to keep those boundaries, but we have to be mindful of that. I've had my own daughter bring people home from school that I worked with in a group, and I'm like, oh, I can't, what do I do here? You know, I just didn't say anything, but the girl disclosed herself. that I was her counselor to my daughter. And I would tell my daughter, I said, still, that's confidential information. I said, so my daughter goes, well, I didn't know that. And I said, yeah, we're not supposed to tell, but she disclosed that to you. I didn't.
Yeah. Wow. Someone said, you spoke on this a little bit. I'm wondering how you would handle mandatory reporting. Do you go to both law enforcement and the state social services children agency, or will one suffice?
It depends on the situation. I've done welfare checks on patients that were suicidal. And I think that one was, I was on call. I was on the crisis call. And so the first thing I did was tell me where you're at, you know, give me your information. And then they disclosed to me they were feeling suicidal. So I immediately contacted the police. As far as mandatory reporting, I have had situations that I have had to report, but I was directed to contact the Department of Family Services, and that's here in Wyoming, and that the Department of Family Services would complete their own investigation, and if they needed to involve the law enforcement, they would. So that was a different situation. So on the suicidal client that I had on the phone, I was like, I need to get somebody there now. You know, this person could possibly take their life right now. So you have to contact the police. Domestic violence, I've had some of that. Gosh, I want to say closer to November, October. And it's because of this telehealth and Zooming. We had a lady who wouldn't show her screen, and we're like, we need to see you, you know, everybody else is here. And she gave me a message that she would tell me after why she wasn't letting us see her. So I just had to keep going. When she finally turned the camera on herself, she had been beaten very badly. And sadly, she was caught up in that domestic violence, battered woman syndrome of like, oh, things are going really good right now. This is the best we've ever done. And I'm like, we have to educate our patients to the cycle of violence and that these things happen as and part of that cycle. We encouraged her to make the call herself because she still had physical evidence on her face that we could see.
Yeah. Wow. So we have a question about the recording and the slides, and I just want to remind everyone that we will be sending out all the resources talked about here today and the recording in the follow-up email coming up in the next few business days. So we have a question. How would you approach, oh, this sounds pretty controversial. How would you approach a work situation where a member of your team may not be using alcohol or drugs, but are demonstrating being maybe overly sexual with other clients or staff?
Wow. So it's the person you're working with that is doing this behavior. And that was a question that I wanted to pose to everyone that attended today is, what if one of your colleagues is doing something inappropriate, and how would you handle that? Again, that's giving it back. And I would have to go directly to my supervisor, and I'm the supervisor where I work. So I would probably call the person in for a meeting and let them know that you're violating professional conduct code, ethics. And I did have, here's a crazy one, and this just happened to me very recently, was they didn't report to the board, but they were to the licensing board, but they reported to my board of directors of my company. And it was for a person who is on conditional license because she did have violate a boundary, and she wasn't, I don't want to say the correct word, like mandated or punished or anything, but she was given these certain requirements which gave her conditional license. And so one of my staff found out and reported that, and she didn't understand. And she just assumed that because this girl had this interaction with the client at a different agency before she came to us, that, like you said, she might go in there and be sexually overactive with the men. And some of these guys just come right out of prison that I work with. And I was like, you know, I haven't even done that. And I had to confront my staff because it was, I narrowed it down to they're the ones who reported to the board. And I said, you know, you always need to come to me. I could have, you know, addressed the situation with you. And I've had people say stuff, but it's always been about someone else, somewhere else. It's never been exactly where I've been and that I've had to report that. I've never had to report a colleague of mine, only clients that have had situations that have happened to themselves that I've had to report. So that is a really tough one, but I would say definitely go to your supervisor, look at your code of ethics, and make the best decision you can based on your personal values and professional judgment.
Mm-hmm. Definitely. All right, so we have a question. There are numerous text messaging campaigns being utilized to reach Native youth and/or adults. How do you see ethics and code of conduct applied or not in this platform?
Let me look at that question right here. Okay, there are some programs that are incorporating texting into working with clients. There might be reminders, we're having group tonight, or don't forget to get your assignment done, but they should be signing on the front end that they agree to receive text messages. Like I said, I get texts from my dentist when they remind me I have an appointment. And so if it's like that generic, I don't see anything that's ethically wrong with it. I got myself a Google number for my personal cell phone, and that Google number is free. Anyone, as long as you get the Google, you use Google, you can create a number. It doesn't cost you anything. So that's the number that I give to clients. I have it on my business card so that this way I don't get all my business calls and clients on my personal phone, but you still get the messages. I have a client texting me this morning saying she's got something going on and she's not going to make it to her group tonight. So it just depends on how it's being used. And I would assume if you're using a program, that research is actually showing that using technology has been advantageous to the youth because they're so technology minded now. You know, kids are using iPads before they can walk. I didn't really use a computer until I went to college in my early 20s. And, you know, back then we still had the monochrome monitors that were huge and they weren't colorful.
Yeah, for sure. Awesome. All right. How would you approach a counselor who appears to be doing their program alongside the clients? Would you consider this an ethical concern?
Doing their program with the clients?
Alongside the client. So maybe they're also in a mental health program and then they're in a mental health program and then they're also seeing clients at the same time. It sounds like that question. It sounds like that's what they're trying to say. Oh, it's a drug and alcohol program, and they are in recovery. So they're in that program, and then they're also counseling. Would you consider this an ethical concern?
That would really create that dual relationship we were talking about earlier, because that therapist is in the program with the client doing treatment right along with them. So that would be a dual relationship. And then if they were working with them, they should at least be mindful to excuse themselves as a conflict of interest. You know, like I can't be in that group because one of my clients that I'm working with is in there. And I have peer specialists, and they're in recovery. They live a life of recovery, and they don't become peer specialists until they've been in recovery for a few years. And on the reservation, I had a female peer specialist and a male peer specialist. And on some level, they were doing their program. See, these are different situations. Since they're still in recovery, they're still going to their AA meetings and things like that. But they will run support groups. The guy does it for the men and the one does it for the women. So in that situation, I really see the peer specialists as role models for these people that haven't established their recovery yet, but they're able to see someone who has been successful, who's actually employed because of their experience. So it creates some different situations, but it's being able to remove yourself. I have a client, and this is just for example, I have a colleague whose family member is in one of my treatment programs. And so when I have to do staffing, I have to tell her, you need to excuse yourself right now. And so she does. And she's even made it clear to me, I don't want to know nothing, and
Yeah.
if he goes anyplace else besides our program, he's going to pay, because I run a nonprofit, which means I have a sliding fee scale. So not every place in town operates on a sliding fee. So
yeah.
I don't know if that answered the question exactly.
Tara, I noticed that you had some further comments for that question. Would you mind discussing that with us a little more?
Sure. So I guess I'm the director of the Full Circle program in Rapid City. I've just had some current complaints, I guess, from clients about a counselor that appears to be working her own program. She's been in recovery for 20 plus years. She's a counselor here and runs our core treatment. And I guess they're thinking she's working her program right alongside them, which is, is that an ethical concern, or is that more of, I guess I'm not really sure. I've never come across this type of a situation where I'm getting that type of feedback.
Okay, so this person is a counselor who's in recovery.
Correct.
Okay. Again, I see some blurred boundaries. I don't understand how they could be doing is this person facilitating the group?
Yes, she's our core treatment counselor. She has been in recovery for, like I said, 20, almost 30 plus years. She is not, when I say working her program, they feel like she overshares her experiences.
Okay, yeah, I got you
so
now.
She's not working her, that's how it's been reported to me.
Okay. Yeah, it depends on the individual. And if you're getting feedback about oversharing, that person who's running the group might want to address this issue, maybe with a colleague in attendance of, how she sees it. I mean, you know, not knowing what this person is doing exactly, I can't tell you,
Right.
because they're living a life of recovery, even
Correct.
though they're a counselor, because I have a lady who has 20 something years, and the guys that we have in our program really like her because of that. But
yes, and most do. I think there's just been a few times lately that they feel like it is overshare, almost to the point of maybe glorifying, is what I've been hearing. And I have spoken with her about it. I guess I'm just wondering if that is an ethical concern alongside, obviously, you know, other issues there too. But
it would depend on your agency's policy and procedures of what your agency believes is best in serving the clients as a counselor in recovery.
Okay, great, thank you.
And if you do some searching, I've found lots of policies just by Googling on the internet.
Okay.
The company I work with is so old, their manual is, gosh, I can't even tell you how many years old it is, but we're in the process of updating that and making it a digital format. So they still have the 3-whole binder with all the pages in it that you have to go through. And, you know, maybe that is a policy that you need. And maybe this is an issue that this person needs to work on.
Okay.
And then there's a way of putting that out there of like, you know, I've had a similar situation. Would you like to hear how I handled that or how I've dealt with that? But really, maybe even a professional improvement plan of, you know, this is one thing you really need to change. You know, not that you're a bad counselor. We all can use some help in making things a little better for everyone, including ourselves.
Right, and that's what I've been trying to coach in supervision, is that type of a mentality. And so thank you.
There is a really good book, and I don't think I have it here, but it's Ethics in Addiction.
Okay.
And it's sitting on my shelf in my office, but it covers a lot of really good case scenarios that might be helpful to you because
Thank
it has
you.
the ethics specific to addiction work.
Sounds great. Thank you so much.
But and then I have the peer specialists who don't have degrees, but our state acknowledges them just as if they were a licensed counselor. So I do have them. I have had them in groups with me while I'm counseling a whole large group of people, and my peer specialists have been in there. So they're doing their treatment with them. You know, if I'm giving a handout or have an assignment, they're participating in that too. So those peer specialists, again, that's a different situation. They're actually participating with the other clients.
Yeah, looks like a couple people commented. I've been taught that person with years of recovery should only be sharing their experience in self-help groups. In the professional setting, we are trained to apply educational information. It's a difficult balance, but clear lines should be in place. We have another one that says the staff should be spoken to about his or her boundaries and use examples of how they may be crossing them. Sounds like that counselor is not intentionally doing it, but until they are told otherwise, that they are doing harm. Sometimes patients are also looking for reasons to not embrace treatment unless it's truly harming them.
Okay, I like that.
Yeah.
Every agency is different.
Mm-hmm. Thank you for sharing your question, Tara. Alrighty, looks like someone asked, I'm a certified substance abuse counselor, but my job is a parole officer. Do I still have to adhere to the code of ethics?
Are you currently certified?
Let's see. That's all they put, but maybe they will. Yes.
I would say yes. If you're currently certified, that means you agree to follow the code of ethics for substance abuse, and 9 out of 10 refers to the NAADAC code of ethics.
Yeah, they said, I work in a drug court program as a parole officer.
Okay. Yeah, I've never encountered the parole officer actually being certified, but that might be a plus because a lot of the people we do work with are struggling with drug and alcohol disorders.
Michelle, do you have a question? They raised their hand.
Okay.
Is it Michelle or Masha? Let's see. Oh, there they go. Hello. They might be having problems with their mic, maybe. Oh, that was an accident, they said.
Oh.
Sorry, Michelle. I just wanted to make sure I'm not missing anyone.
Okay.
Okay. Alta asked who's the author of the book. Maybe she means the
one that I'm referring to?
Yeah.
Trying to think. I'm trying to see if I can find it on my phone. Let me see if Amazon will pull it up. I can't remember where I got it. I might have got it from the ACA. Here it is. They've got it. It is by Jennifer Burton, Berton. And I don't know if you can see this.
Yes. Perfect. I will also type it.
It's a really excellent book. I highly recommend it for substance abuse counselors. I've had to go home to the reservation, and a lot of the counselors that we have working with the clients are certified. We call them certified addiction professionals. That's a CAP. And then we have certified addiction professional assistants. That's a CAPA. And so they don't have the master's level of teaching or knowledge of ethics. And so I've actually used that book to give them some training in boundaries and ethics specific to addiction work.
Avis, we have a couple of participants asking if you can hold it up one more time.
Okay.
I'll also type the title in the chat box too. I typed the author, just not the title.
Okay. You know what? I am just now thinking if I am on, sorry.
Oh, no worries. Are you pulling it up?
I'm hoping I can. This is my new computer, so it might not pull it up how I want it to. My old computer actually has my account. Ethics in addiction. Can they see that?
Have you shared your screen on Zoom?
Let me go back to Zoom and I will hit share screen and I'll hit share. And okay, now that's on my PowerPoint. Okay, now I lost it. Here we go.
Perfect. Yes, we can see that. Ethics for addiction. All right. Awesome. Thanks for pulling that up.
Oh, no problem. Okay.
Perfect. Clem asked about CEUs for this webinar. So Clem, this webinar will be 1.5 hours for CEUs. Hope that's helpful. I can also post the ATTC website so you can see all of our upcoming events if you'd like to earn more CEUs with our center, if that would be helpful. Looks like we have one more question. I'm talking about my Facebook page. I'm active about posting mental health stuff on social media. I get followed on Facebook and I usually block anyone who's inappropriate, but I've never had a patient say anything on my post. So it looks like it's like a mental health page and like the ethics around having that for reaching clients or whatever. Do you have any like ethical tips or maybe like boundaries you would use if you had a page like that?
So
Or
it's
maybe it sounds like
a closed group?
it doesn't sound like it actually. Now that I'm reading it again, they have a Facebook page active about posting a lot of mental health stuff on social media, and they get followed on Facebook, presumably by some clients. I block anyone who's inappropriate, but I've never had a patient say anything on my posts. They just look at them.
It's different in different situations, and I'm thinking on the reservation, because of the COVID, they actually created a treatment program Facebook page so that they could post information for the clients, like maybe a certain group is not going to be held today. And so they're making sure that people know what's going on. And if it's just all specific to substance abuse and not personal type stuff on there, I don't see any problem with it. It's just the only place where you blur that boundary is when you accept their friend requests or you intentionally request them as a friend. So that can create a dual relationship. And I haven't had any staff, I haven't had anybody tell me that they've had any problems with that, but I do know my company has a policy that's old and outdated that says we can't do any of that. And my argument is I see these other counseling agencies that are my competitors in town that do have company Facebook pages. And so people are able to access their website and get all the information they need right from that Facebook. So that's why I say it depends on the situation.
Yeah, definitely. Alrighty, I posted the calendar for ATTC, and I will also post a link to our listserv in case any of you would like to join that, because we do send out reminders for events, especially webinars. So just to make sure you don't miss any of our future upcoming webinars, that's our listserv link. And you can also sign up for our other centers that offer prevention, mental health, and so on. see. Looks like someone else has a question.
Hello.
Hi. Hello.
I have a question for you. You know, I work a lot with young people, and well, actually, I've worked with actually the grandparents, parents, and now the kids now within foster care, relative placement. And one of the things that I'm running into, especially from urban to reservation and out there within the children work in their programs, is that they run into and they really know how to master manipulate their their social workers. So when they pretty much program hop or you know, when they get change of social workers and this stuff, they really know how to manipulate a situation. I mean, really, really good, right? So what they do is they start creating chaos when they don't get their ways in out there. But my question to you is, from what we have on file and what we experience with them, and you know what we write up, and we want them to go on, you know, want this information to go on with them, even when we bring it into court for it to be forwarded and make our recommendations for another county or something to pick up their counseling and out there, it gets lost in translation and out there. And you know, they think, oh well, they've already had their counseling, and you know, because the kid has already manipulated somebody else. And so you think they would learn by the number of placements they have, but it's just an age-old problem. So have you experienced anything with the tribal systems in out there of having a foundation, you know, like a database for some of the children coming in and out that have multiple addictions? This is a big one, but I mean, boy, I just have a tough time with things changing, and I'm wondering if there's if you know of any place that has a real good system to track them.
So you're saying they're working with, this is a treatment program they're in?
Okay, no, I'll give you an example. Okay. Okay, in the state of Minnesota, you know, if a child comes, especially if a child is tribal and they're put into placement foster care, right, and they're in the urban area.
Okay.
And so when they finally come to me, they're already in placement and I'm part of the recovery plan for them.
Okay. Okay.
And then when we put the program together for them and work it, and we have to literally go out there and research and to pull in all this data, because the data does not come with them. So unless I go into their NA systems to find out that they have been into multiple treatments or multiple treatment placement homes, this information doesn't come to me. So if they're going back to a grandmother or somebody on the reservation, we're doing the referral, sending it to them that this is what we'd like them to do. So when it gets into tribal court with a judge, he can have this information there. But a lot of times that information gets lost into from the urban, from the county, and going into the federal level. So the kid kind of gets by, and he knows, they really know. I'm working with one right now, really knows how to work the system and out there, and I'm okay, and I'm doing good and all of this stuff and out there. And it's kind of bouncing around on this methadone program that they're kind of getting double boost and all of this stuff. And it's can be very deadly for this child. But now this child is bordering 18, but yet still has an IQ of 11-year-old. And you know, we did the referral placements until they're 21. But I guess what I'm trying to say is, have you heard of any place that has a good database that is jointly with federal and state and county, you know, with our children? Oh, I don't like you shaking your head.
There is so much violation of confidentiality there that I don't know how that would be possible without the a guardian who is in charge of the patient to sign releases, to, like you said, do research, contact the treatment agency and get their evaluation, again, with the parents or whoever is the guardian signing that release of information to get that information. There isn't, to my knowledge, a bank that we get this kid Mary and we don't have the information that we need. And, you know, like you said, they're master manipulators, so they can say whatever they want when they get to where they get placed and be like, well, I don't have to do anything, or, you know, they find a way to get out of it. But I just don't see a place, and that would be up to the state. I would, and I see what you're saying is I work with the corrections a lot. And yesterday, one of my staff was saying, we didn't get the information that we need. So I told him, I said, you need to contact that person's probation officer directly, and they should be able to provide you with that information. Because I do know we get releases on our end, and it's not something that is just readily available to anyone, to my knowledge. So you make a very good point on how helpful that would be. And it looks like it is a problem that you really need to put some effort into finding how you can improve that system for your agency that has to work with these youth.
Okay, thank you. Oops.
Awesome. Thank you so much for joining us. We really appreciate it. All right, looks like we have time for one more question.
Okay, I like these.
What happens if a counselor has issues with their clinical supervisor and it turns into a grievance and the counselor gets an attorney? Should the supervisor and the counselor work in the same workplace? In the meantime, the counselor uses the legal instructions not to work or adhere to the supervisor's instructions. It's definitely an ethical dilemma.
Oh, that's a big one. I'm the supervisor where I work, but one of my counselors is supervised by another counselor who's been there for a long time. And I can't imagine them. I mean, I see it as just like any counseling relationship. If you remove the supervision piece out of it, I might go to counseling and I don't like that counselor, you know, or something that they did I didn't like. I mean, then we're able to not have that person as a, you know, basically we fire them without telling them. We just don't go back. And in a work situation, I would have to know if that is like an ethical reason that they're not. And I would also, again, I'm assuming that if they were having a problem with me, I wish they would tell the supervisor directly. Because if there's another option available, maybe they just don't work well together. And if you have that resource, my agency is really small, so there's like almost no chance of that happening unless they went to my other counselor who's been there for a long time that does do some supervision. So I would hope that they would tell me they are having a problem directly, but it's just like anything else. I can't force them to be my supervisee, and we could at least search other options for them that might be helpful to them in finding the supervisor that they're really looking for. And I know on the front end, if we're bringing these students in, we have to sign an agreement, a supervision agreement. So, you know, that has to be covered on the front end. They might even, you know, include in there, if you have any problems with something that I'm doing, please, you know, bring this to my attention. And this guy won't leave me alone, so.
Aw, so cute. Awesome. Well, thank you so much, Avis. I hope that answered their question. Pretty sure it did. Awesome. We have some good feedback too. This has been an eye-opener. Thanks for the book shout out. I'm entry level, so this is all new for knowing this process. Love the dog. Got some comments. Oh, that's so awesome. All right. Well, I just want to say thank you again to everyone who joined us today. Thank you, Dr. Garcia, for such an amazing presentation again today.
Thank you.
Yeah, lovely questions from everyone.
Yeah,
really
good
good
ones.
engagement.
Really good ones. Thank you
Awesome.
guys for taking time to be here today.
See you next time.